Welcome to the Mindset Connection podcast, where we showcase everyday change makers doing extraordinary things in the field of mental health and wellness. Thank you for joining us for our 17th episode. We hope that you are just as inspired and amazed by our guests as we are. And we are your hosts, Jennifer Clearwaters and Cynthia O'Connell. And today we are welcoming our friend and amazing acupuncturist, Danielle Lichtenfeld, to our podcast. So thank you.
Thank you for having me.
You're joining us.
All right, so a little background information on Danielle. So Danielle holds a bachelor's in psychology from Montclair State and a master's level diploma from the Eastern School of Acupuncture. She is NCCAOM certified. I'm not sure what that means, but she'll probably tell us, and holds a medical license in acupuncture here in the state of New Jersey. She is a meditation teacher. She is an RYT 200 yoga teacher. She has been practicing acupuncture for 11 years. And her role as a provider is to hold safe and supportive space for vulnerability and heart opening while empowering her clients' patients to take an active role in their healing. And through various trainings and self-exploration, Danielle is also able to guide patients through a blend of the intuitive and physiological practices of acupuncture. So she also can make recommendations that are covered in the acupuncturist scope of the practice on physical movement and meditation and other modalities. So Danielle is a healer. If you've ever had the opportunity to be treated by her, as Jen and I were just talking before the podcast started, that our whole families have been to Danielle and we recommend her all the time, you will immediately know that you are in the hands of someone with a true gift. So without further delay, let's hear all about acupuncture. Thank you so much, Danielle, for being here.
So let's talk about acupuncture. Cindy and I know, and our families, because we come to you, but oftentimes people will say, oh, I've never done that, or I don't know what that is. So maybe you can explain how you went from majoring in psychology to going to acupuncture. And then if someone were to come in and do a session with you, what does it entail?
So the short answer of how I became an acupuncturist is I had graduated college. I started taking prerequisites to go into nursing. I didn't really want to go into psychology anymore. And I had some friends who were nurses and they just seemed really unhappy in their jobs. And now looking back, I realized they just didn't enjoy what they did. And that's why they were unhappy, or they were unhappy in life. It wasn't because they were nurses. But, I was, 23, 24. I had no idea what I was doing with my life. So I was working as a box office manager at a theater, and a boyfriend at the time said, oh, my friend goes to acupuncture school. And I said, oh, that sounds fun. And then I ended up getting laid off from my job and thought, oh, maybe I'll just go try this thing out and see what the school looks like. I went there. I saw the school. I'd never had acupuncture before. I had never even, I don't think I've even had a massage at this point in my life. And I just said, oh, yeah, whatever, I'll just do this thing. Flash forward 3 years later, all of it comes together where I think, oh, wow, I had been studying and practicing and preparing for this for my whole life because I was very sick as a child. So I did a lot of breathing and meditation. I read a lot all through college. I took reading Asian cultures and Asian studies with my psychology degree, philosophy classes, and it just all kind of came together.
It was a calling for you.
Yeah. It really was very synchronistic.
Yeah. Mm-hmm. So what does it entail? Like, who do you see for acupuncture? Sometimes I get that question, like, who goes to acupuncture?
Who do I go to see personally?
No. But people who are asking about it will go, well, who goes to acupuncture? Like, they don't know. So what's the scope of people and clients
the demographic
that you see?
I mean, literally everybody.
Yeah,
I've treated from, 4, 5, 6-year-old children up until into their 90s.
Mm-hmm.
A lot of times, the youngest case I had, I believe she was 5 at the time. She had a tick-borne illness that wasn't Lyme disease. And so her hair was falling out. Doctors were telling her that she was just depressed and that she didn't want to go to school, which is something that I heard a lot when I was sick as a child. So it really resonated working with her. I really enjoy working with children. I don't get the opportunity to do it very often. But yeah, she was really young. We started off with just some acupressure, and then we worked up as she became to trust me with needles. And that in conjunction with the antibiotics that she was on, she did really well with it. And then, people who are in their 90s, their 80s, a lot of them are avoiding or can't have surgery because of their age and previous or comorbidities and other health issues they have. So they'll come to see me to help either prevent having surgery or put off the surgery or receive some kind of like comfort and reduction in pain so that they don't have to live their lives on medication as much. It just depends on the case.
Is that the, what are the most frequent reasons why people are coming to see you? You just mentioned pain management, but what are the other frequent, reasons why people are seeking acupuncture?
A lot of it is pain. They start to come see me because they're in pain, but in conjunction with that, generally pain goes along with that. Anxiety, stress release. I see a lot of fertility cases, which is also another thing that I really enjoy treating and being a part of. It's really a really big honor to be a part of somebody's journey with that. And then I see people with autoimmune diseases. I do see people who come in because they want something to help support them with depression, like I said, anxiety. And I always, make it very clear, as you both are mental health practitioners, that acupuncture is a great support system for all the other things that we do in our life. So if some people want to come in with support with weight loss, we don't just come in, I do some needles and you drop 15 pounds. You come in, we talk about what's going on in your life. We choose points based on whether you're having cravings, whether it's stress, whether it's all the above. And in conjunction with that, I talk to them about, just getting healthy versus losing weight, which is something another friend of mine who's a provider had said to me. And I said, I love that reframing. It's really a good reframing for people because we're so hyper focused on being skinny and not focused on, well, what do I need to do to feel healthy and feel good and safe in my body?
Yeah. And I think you see already that, Danielle is someone who spends time with you. So you're not just coming in and throwing some needles in and walking out. Like there's a conversation that's happening.
Oh,
You're really part of treating somebody's overall wellness.
For sure. So I actually followed Danielle. I think it's close to 10 years. Yeah. Wherever she was, I went. So because there was no one else that I was it's not a question of not trusting another acupuncturist. It's just a question of I know what she can do and how much care and attention that you get when you have a session with Danielle. It's as if you're the only one she's treating that day, even though I know in the place that she's in now, she sees 80 to 90 patients a week, which I don't know how she does that. But can you explain the science of acupuncture? So what is it about acupuncture that makes it work?
So basically, we're tapping into channels along the body, meridians in the body. And by doing that, we are increasing blood flow and oxygen to the body. We also, so let's say you come in for low back pain. I will do points on the head, the face, the neck, the ears, the legs, the feet, the ankles, the entire body, because what we're doing is we're treating locally, so I can treat locally to where the pain is, and then also distally. Distally means further away from location of pain. So when you treat something distally, it helps reduce that brain-body pain signal. So let's say you come in, you have low back pain. I can't even touch it. I can do some points in your ears. I can do some in your hands, your feet, and that will help reduce that pain. And then if it's so severe, my hope is that we do that for a couple sessions, and you can come back and we can treat locally, because that really helps and is beneficial for releasing muscle tightness trigger points, which is super fun because you literally get a great muscle release and the patient feels a little sore maybe after, but it definitely helps move things along in terms of their physical pain if you can release that.
So how do you know, I come in and I'm telling you that I'm not sleeping. All right, because I think that's a common complaint.
Common, yeah.
I'm not sleeping. Okay, so where are you going to treat me?
You might think, hey, just put them in your head. Right?
Yeah, put it in my head
because
it is all in my head, right?
So it depends on the person. I mean, there are some point protocols and things that are great for just generalized stress release. A lot of those points I do are in the ears. A lot of them are on the head and the scalp. But it also depends on, your you as an individual. So if you come in and you say, I'm not sleeping, and I'll ask you a series of questions like, well, how many hours of sleep are you getting at night? What is your pre-bedtime habit look like? Are you on your phone when you go to sleep? Do you sleep with the TV on? Do you sleep in a bed with somebody? Do you have pets? Like there's lots and lots of questions that go along with that because it's individual to you. Some people it's, they fall asleep, but they can't stay asleep. Sometimes they can't fall asleep at all, but they finally fall asleep and then they wake up and can't go back to sleep. Some people it's all of the above. So some people, this has been years and years of not being able to sleep. I see a lot of people that are on medication, and unfortunately, if they've been on that for a long, like a sleeping aid for long term, it is difficult to ask them to stop taking it. But I do things to still try and support that. But the long answer is that it just depends on the person individually. What kind of, is it stress based? Are you a shift worker and you work overnights? Because those kinds of things will really affect your sleep schedule. Daytime sleeping is not the same as sleeping at night, because in Chinese medicine, there's certain times of day where certain organs, it's like their time. So in the middle of the night, you want to be horizontal, generally between 9 and 10 o'clock, so that your body is at its most optimal for like your liver and things to rejuvenate while you're sleeping. So overnight work is not really ideal for that, and kind of impossible.
Shift work is really tough.
Yeah. So with acupuncture, my hope is that even if you're still doing a job like that, or you have other things like medication that you're taking, we can still do things to support that. But again, long answer is it just depends on what they have going on at home and in their own life.
Right. So I think that, you can, as you listen to Danielle, you can see that she's just not sticking needles in you. She's asking critical questions.
Yes.
It's almost like she's a mental health therapist, even though she's not.
Make that very clear with
yes,
for
but
sure.
She's not. But, a good physical therapist, a good occupational therapist, a good acupuncturist, people that work with the body really have to work with the mind as well.
And you have to know your patients.
Yes,
you have to
for
know
sure.
them. You're not like, look how many questions you get. And yes, sleep is a huge issue. But look how many different variations of that question, like, oh, I can't sleep. And you're like, oh, well, is it this? Is it this? Is this? There's so many different reasons behind why you're not sleeping.
Right.
So it really is, it's a process. It's a process.
I'm going to ask you another question too, because, as you're talking, I'm remembering things that you have, done with me while I've been on the table. And one of them is that you would take my pulse, but not you'd say, oh, let me check your pulse out. So can you talk about that? But because you're not really, you're not really listening for numbers.
No, well, I'll be honest. Pulse taking and tongue diagnosis is such a practice. And I will say that is not my strong suit, but I do check
You
pulses.
could have fooled me.
I do check pulses though, as a way to just kind of like, I kind of want to feel, I'm not really checking for heart rate, but we're checking for pulse quality. So there's different layers to the pulse, and there's different pulse qualities. There's different organs associated with, there's 3 levels. And so when I check the pulse, one, it's a good way for me to kind of connect with the patient. And just kind of like check in with my own energy and how it's, vibing with theirs. I know that might sound a little woo-woo, but I think it's good to kind of connect physically with somebody in that way. And then I kind of see, so if somebody has a slippery pulse, for example, that in the books, they say it feels like pearls rolling in a dish. So if somebody's pulse is slippery, that might mean indicate a lot of dampness in the body. If somebody's pulse feels like you're plucking guitar strings, like wiry, that's sort of indicative of something going on with the liver, and not necessarily the actual organ, but like energetically. So based on those different things, I can kind of put together a treatment protocol of what I'm going to do that day with that person.
So interesting.
It
really is.
There's so many layers to it.
Yeah. So I want to ask you, the biggest thing that I always hear from people is like, when I
I know what
suggest
you're gonna ask.
acupuncture, I always get, I'm afraid of needles. And then I go, well, it's not like the needles from the doctor's office. And then that's usually the biggest thing is like the fear of like, oh my God, if I go to Danielle, she's going to put needles in me. So explain a little bit, like, how does that work, and what are the needles like? Because I know that's like a scary part for people who have not experienced it.
Yeah. So it depends on the person. So if they come in and they're like deathly afraid of needles, first I explain to them what the needles are, and then I ask them, oh, do you want to see what one looks like? Will that make you feel more comfortable? A lot of people just don't want to see them. So basically the way I explain it to them is, when you go to a doctor's office or you go to get blood work done, those are hypodermic needles. So those are significantly thicker. They're probably about 20 gauge needles, and they're hollow. So that's why they can be more painful. So if you put something hollow into the body, it's because you got to take blood or inject the fluid. So they're hollow, so it's going to be more painful. Acupuncture needles, I tend to use pretty thin needles. I use anywhere from 40 to 32 gauge needles. So for example, your ear piercing, if you have your ears pierced, that's generally like an 18 or 16 gauge. So the higher the number, the thinner the needle. And those are also hollow. So my needles are single use sterile, non-hollow, so they're going to be pretty painless. It just depends on the area of the body. Sometimes you get a zinger. Sometimes you get a really
No, I
strong
do.
sensation.
We probably shouldn't say that, but yes.
Yeah.
But they're always in a place where you need it.
Yeah.
Yeah.
need
So
it.
sometimes if there's a tight muscle, like I talked about earlier, if there's a tight muscle, you might get a trigger point release and the muscle jumps. That's really normal. So because the channels start and end all over the body, I might put a needle in your ankle and it'll shoot down the bottom of your foot because that's where that channel starts. So it just depends on your body and where you are that day. And some days you'll feel nothing, and then some days you might get a really strong sensation. It just depends.
And I think it's interesting that you just said that it's the way you are that day.
Yes.
Because if your body is stressed, let's face it, you're tighter. And do you agree? Am I on the right track that if I was like kind of like tense this,
definitely.
you're going to stick a needle in me?
Yeah, definitely.
Yeah.
And, for women, for example, for women, there's something called like yin channels, and a lot of those tend to be on like the inside of the body. So if a woman is close to her start of her menstrual cycle, or ovulating, sometimes those points will be a lot more sensitive around that time of the month than it would be other times that month. So the body is different every day. You come see me now, and then tomorrow come back in. It could be a totally different story.
That's good to know.
Yeah.
So you are also a yoga and a meditation teacher. So how do you combine what you know about yoga and meditation with the patients that you're treating for acupuncture?
So partially it's selfish because, doing the meditation course and getting my yoga cert, a lot of that was just to kind of help me come back to my own body, because sometimes when, my day is basically completely focused on other people and what's going on in their lives, and it's hard to not take that home with me, take that back to my desk with me when I leave those rooms. So meditation and breath work and yoga have been so instrumental in my own healing and my own practices. And it also keeps me present for the people that come into my treatment room, even on the days where I'm like, I'm not always having good days. Some days I'm having horrible days. And most of the time people don't even know, because I try to make that their space. So acupuncture, meditation, breath work, all those things have really helped me to be that version of myself for them, so that I check all my stuff at the door and then I walk in that room and I can make it all about them, which is what everybody deserves.
Yes, especially if you have someone who's a little anxious or not feeling well that day. They want to be greeted with someone who's calm and inviting, rather than us dragging our baggage in to work with people. So it's really nice. And then I love that you also do make recommendations for how someone can care for themselves after they leave you.
Yes. So generally, just back to the whole needle conversation, people being nervous, sometimes I'll give them like a breathwork exercise. Conscious breathing is my favorite one to give people because it's so easy. I'm just like, you inhale, you say inhale, you exhale, you say exhale, done. Just keep doing that until I come back. You've got this. You'll be fine, And I also give them a a button in case they need me.
I was just going to say,
So,
there's a special red button.
Yeah, the little button, it's like in case they need me. I have like, space, like, those like those like blankets you can put over, those emergency blankets, so they get nice and cozy and they can always get me if they need me.
And you have a heat lamp.
Yes,
heat lamp. Yeah, I have a heated table for like colder months. So so people can feel as safe as they possibly can with also knowing they can reach me.
And it's nice though, because then if they're coming and then they're not coming back to you to say like another week, they can practice. Even if you give them a simple breath work exercise, they can practice something.
Yeah, I usually tell them like, just do 5 conscious breaths today. So that's 1 inhale, 1 exhale. And I feel like everybody can do that. Even I can do that, because Cyn is always reminding me. She's like, breathe, swing your arms. I'm like, oh yeah, I got to do that today.
We have to practice.
Yeah, we have to support each other.
Yes,
exactly.
Yes.
So, for sure. You said you were, you had a childhood illness, and you, so looking at you today, and I know that you run, you do yoga, you lift weights. I mean, you're a beautiful woman, and, you're physically fit. How did you arrive at this place from being a sick child?
I would say, going to school for acupuncture was a huge sort of awakening in that way. It was very instrumental in me being like, oh, I should probably be paying attention to more things in my body. Like I said, I'd never had acupuncture, so I had no idea. I thought I was just going to go to school for a couple years, throw some needles in people and like, I don't know, treat shoulder pain or something. I didn't know that all these other things went into play with that. So when I got to school, everybody was like, oh, you should limit your caffeine. You shouldn't have so much dairy, all these things. It brought me a lot of awareness around my digestive health, where I was like, oh, I'm eating, lots of processed sugar, drinking lots of alcohol. Cause I was like 22, 23. I was like going out and, doing my thing. So that was really huge in terms of my like awareness around my own health. And it's been a process, and it still is, because I do, I just turned 40 this year. Or just last November. So, I do notice a difference between how my body digests and processes things, such as even not just food, but like the things I drink, the social media that I consume, the relationships I have. So I have had to like kind of, taper those things back. So yeah, I run, but like very slowly, yoga. I definitely don't, I know I can put my foot to my head, but I don't really do that anymore, because I'm trying to just kind of protect and,
Yeah, it's changed a little.
Exactly. I don't recover the same way that I used to. So, it's just an ongoing process.
And I love that you're using the word process, because I think that's what people don't understand.
Yeah.
And we had this conversation yesterday that, you are the best version of yourself right now in this moment, because it is a process and you are progressing. You're always looking to learn something new. I know every time I walk in your office, we have a philosophical conversation. It's not just, she's going to stick needles in me. It's definitely, you walk out and you feel like a little weight's off your shoulders.
Always feel better when you walk out.
Oh, I love
Always
to
feel
yeah,
better when you
it's
walk
so true.
out. But,
so true. I don't think I tell you that enough.
No. But I want to just go back to you being sick as a child, because, when you're sick and you're a kid, it's so hard, and you might feel like, I have patients that are ill, and even adults that have been chronically ill that will come in and say, like, I felt like I was the only one that was going through this, and there maybe wasn't help years ago like there is now. There maybe wasn't an acupuncture treatment or someone who might even understand. And a lot of children who are sick as kids, they miss out on a lot. And they don't feel like they fit in, or they might be in treatments and they miss a lot of school or whatever it is. So they have a hard time. It's a lot. So how did you deal with that growing up, and get through everything that you needed to get through?
I read a lot of books, like a lot of books. I read, I think, I read, pretty much everything, anything from like books for my age. I was like 7 or 8 when I was diagnosed with Lyme. So from like 7 or 8 to like, I was reading like, the R.L. Stein, like adult version books, just like teen books, like pretty much anything I could get my hands on. A lot of science fiction, a lot of, vampires, a lot of, but then also, I guess like a lot of Chicken Soup for the Soul was like a really important series. So I read a lot. Pretty much anything you put in front of me, I was reading. It didn't matter what the subject was. I was into it. And I got really good at typing because I couldn't go outside for recess. So I don't know if y'all remember Mavis Beacon, that typing game.
Yes.
I spent a lot of time typing, so I got really fast.
So now you can do your notes quickly.
Yes,
very quickly. Yeah, exactly. Yeah, I'm a fast texter.
Yeah.
Oh, that's so funny.
It's good.
So, and just to point out, so Danielle could have been wallowing in this childhood where she couldn't go out at recess. I mean, just think about that, being 8 years old and not being, you're the only one in the classroom, and she didn't. Yeah. She found another outlet, and I think that's something that probably reflects the way you are as an adult. You're always looking for that next thing as well, which brings us to what's next for you.
Oh, I don't know.
Yeah.
I have no idea. I'm not sure. I really enjoy my work. I really love what I do. I love working with patients. Right now I'm just focusing on when I have my downtime. When I'm home. I've been on social media a little bit on and off, but I really haven't been scrolling on my phone that much. I think that just mentally, emotionally, I have needed a little break from that. So I've kind of like taken a step back from just like kind of mindlessly going through those kinds of things.
Good.
A couple times a week I'll catch up on all my DMs, all the memes, you send your friends that you can't see all the time. But I really am trying to like make more time for my personal relationships, my dog.
Well, and that was one of the questions I was going to ask you. Cindy mentioned that you see sometimes 80, 90 plus people a week. Like that's crazy. It's a lot. It's a lot.
Yeah.
And that's kind of like your constant, you know, like it's not like just one week it's going to be that and then not. It's kind of like that all the time. So how are you taking care of yourself when you're so busy at work?
I exercise a lot. I get up really early. I make sure I get myself to the gym. Running has been a huge outlet for me in terms of stress. In the last couple years, I started running like consistently again, maybe almost 2 years ago. So getting up, going for a run, making sure that I'm like strength training has been amazing for my mental health. I think the things that I love about exercise, whether it's running, weight training, I mean, yoga, I kind of put it all together as part of my yoga practice. And what I mean by that is, you know, as I'm running, I'm like counting my steps, I'm counting my breaths, you know, and as I'm lifting, I'm inhaling and then I'm pushing and I'm, you know, the weight and I'm exhaling, you know, so
You're connecting it to the movement.
Yes, I do like to find the meditation in all the movement that I have, like all my movement practices. So I think for me, it's just carrying over my yoga practice and my breath work and meditation, which all sort of is encompassed in the yoga practice, into my other activities. Same thing with patients, you know, even when we were in school, teachers would say, okay, you inhale and then you exhale and you drop the needle in, you know, those kinds of things. So it's sort of, it's always been sort of part of this process for me.
Right. I'm sure there are people that are listening that are like, wow, I never thought about being an acupuncturist. You know, what is the school like?
How do I do
I think
this?
it was 3, it's 3 years, isn't it?
Yeah, so it depends. It depends on the state you live in. So New Jersey, you have to have a bachelor's degree in order to get licensed in the state of New Jersey. So you can go to school with just an associate. There was actually a woman in my class who was just finishing up the last year of her undergrad with acupuncture school, which is wild to me. I don't know how she did that. She was amazing. But so you can start the school with your associates or 60 credits, but you have to, in New Jersey, you have to have a 4-year degree. There's a state licensing exam, and then there's 3 national board exams through the NCC AOM.
I see. Yeah.
So, you know, acupuncture, point location, theory, and then bioscience. So we do get, you take anatomy and physiology 1 and 2. We do get some biology sciences like in the school, pharmacology, things like that. So for New Jersey, then once you pass all those things, then they send you your license.
So it's a lot.
It is a lot.
It's a lot.
Yeah, it's a long process. It almost sounds, I mean, nursing school versus acupuncture school, I don't know.
I mean, it's pretty similar.
Yeah.
Similarities
the amount of time. Yeah.
Yeah.
I do think now New Jersey recognizes acupuncture as an actual master's. You can do a master's in acupuncture, and then some programs you can do your doctorate in acupuncture.
Oh, okay.
It's a lot.
Okay.
Yeah.
So you're not planning any more advanced trainings right now?
I'm not looking to get, to go back and, take classes to have the master's at the end of my name, or I'm not really looking to go and do get the doctor at the end of my name. I don't really feel like I need that, but I do take, you have to take, I think
CEUs.
it's 60 continuing education. I think it's every 4 years. So I actually have to re-up that soon. So I'll probably be looking to some classes for that.
So you're always learning. You have to be.
Yeah, you have to be.
So tell us about, I'm sure too, fertility is a huge issue, especially because I think a lot of women have put off getting pregnant till they're a little bit older. I mean, I did. You did.
I did too.
Yeah.
Yep.
So tell us what that involves as you're treating someone who's coming to you for a fertility issue.
So it depends on the person.
I
keep saying that. It depends on the person because every fertility case I've ever seen usually has its own root issue. They're not all the same. So a lot of the patients that I see come to see me in conjunction with IVF or IUI.
Yeah.
And then some come because they're thinking about getting pregnant and they've been on birth control for a long time and they want to start just helping their body self-regulate again. Some just think, oh, I might want to start having kids in a couple years and don't think I have any issues, but just want to start self-regulating again. And then, like I said, some are already going through the IVF process. They've either they were at the very beginning, so they haven't done their egg retrieval yet, or they've already done their egg retrieval and they come to see me the week before their transfer and they're like, I need acupuncture. And I'm like, okay, we'll do what we can, So acupuncture can help increase their percentage in terms of getting pregnant with the IVF. And yeah, it just depends on the person, what they're coming from. Sometimes sometimes they don't have a lot of viable eggs.
Mm-hmm.
Sometimes they're going for IVF and this is their second round and they want something to help support it because maybe their lining wasn't thick enough when they went to go do an implantation. So it just depends on the person and what they're coming for. Sometimes people come and I don't know if they have some kind of genetic disease that runs in their family, so they're making sure they're screening eggs to make sure that they're not having a baby that might have that. So it just depends on the person. Sometimes it's not even that they have a fertility issue. It could just be, like they said, they're trying to prevent a genetic disease. So everybody is different. And that's why it's one of my favorite things to work with because it's so diverse.
You never know what you're going to get. It's always different every day. Every
it's
person.
really, really diverse.
And it seems as though you kind of like a challenge.
I do. It's an honor to be a part of people's journeys. When it comes to like them trusting me with their bodies and trusting me as a safe space for what they're going through, especially a fertility case, because even though I don't plan on or want to have human children, I think it's important to support people.
You're a wonderful dog mom now.
My little nugget. I think it really is an honor and a privilege to be a part of somebody's journey who's going through that because they're trusting me as a safe space for their emotions. They're trusting me to like support them in this way, as a practitioner. And like I said, it's so interesting because it's always different.
Yeah.
It's always different.
Yeah.
And when you think about just the reasons why people come to see you, they like that safe space really is really, really important. So someone that's coming in that's, suffering with anxiety or an OCD condition or something else, they're already escalated. So to come in and then have a practitioner that makes them feel more stressed, would not be helpful because it's the truth.
It is the
truth.
For sure.
Especially someone who hasn't done it before and they might be thinking like they're concerned about the needles and what's going to be like and oh my God. And then when you're asking all these questions, there's always that thought behind, what is she going to think of me if I am honest and tell her what's really going on with me?
Exactly.
What is she going to think? And I can say that like all the people that have come and worked with you never say that.
Yeah.
They always say, wow, like I felt so much better.
Yeah. And I'll also say, as I sit in the waiting room and there's a lot of elderly people that are at the practice that you're in, you can talk a little bit about the practice, but when Danielle calls their name, they're like, hello, Danielle.
Yeah.
Everyone is excited to
excited
see her.
to be there.
So people are happy to get needles.
Yes.
So
they just want their nap. They love the nap.
That's a great thing.
Some people do. Yeah. And that brings us to, you're on a kind of a shortened schedule because of the situation that you're in right now. But what is a typical session in length?
So
what varies, I know, sure.
It does vary. I mean, so I'm like a pretty fast needler. So I generally, if I've already met with, I've seen both of you for a really long time, so I have sort of like a rundown of what's going on with you. But if it's a new patient or if it's a fertility patient, especially, there's a lot of questions that go into that. I usually have to spend, 10, 15 minutes with them in their initial visit, just talking things out. If they've seen other providers within the practice, sometimes it doesn't need to be that long because I already have a rundown of their history. And I can always look back at all of their notes from like whether they saw one of the medical doctors or physical therapy or occupational therapy or chiro. And I can kind of look at that and say, oh, this is what they're coming for. And then I can kind of like, don't really need to ask so many questions about that. And I can kind of skip to like my questions, like, oh, how's your sleeping? How's your digestion? Do you have a bowel movement every day? Are you drinking enough water? What is your exercise? What does your movement practice look like? Things like that. And then I needle them. And then once the needles are in, they're on the table for 20 minutes with all the needles in. It takes about 15, 20 minutes for everything to circulate through the body. Then I come in, I rub a little topical on them if they're having a pain anywhere. And then they go and do their thing.
Okay.
That's really good.
Yeah, great.
So maybe talk about, like Cindy just mentioned, like the practice that you're in. So what type of place, are you working? Because acupuncture, now that it's becoming more mainstream, there's all different types of locations where people are working. So
I work in an office. It's multidisciplinary. So we have medical doctors who can assess and see if somebody needs an injection, epidural, things like that, trigger point injections. And then we have chiropractic, acupuncture, occupational therapy, and physical therapy.
And so while we're on the topic, if somebody is listening and they're like, ooh, I need to find her, where can people find you?
Oh, I'm at Northeast Spine and Sports Medicine in Wall.
Okay. And we'll put that information in the show notes as well.
So what's a takeaway that you would like to share with our listeners?
if you haven't gone for acupuncture, you should go. No matter where you are. I think that it is, like we said earlier, it is a great support for all the other things that you do in your life, whether it's you see a therapist, you get massages, you see a chiropractor another, somewhere else, you go to yoga, you work out, any of those things. It will help your body recover faster from your workouts. It helps decompress the nervous system, so you naturally will be more relaxed, less anxious. Sometimes patients will say, life is always happening, but I've noticed that I'm less reactionary.
Yeah.
I'm able to be more responsive. And something I thought made me think on my way here, I was thinking about, I don't know if this is relevant to your question, but I was thinking about this when I was graduating. One of my teachers, he said, your job is not to fix or heal anybody. Your job is to help them realize that they are perfect exactly as they are.
Yes.
And that has kept me humble. It has made me feel like when I go into that room, that person deserves my all. And I can't do my job without you. So, we're collaborating on this. We're collaborating on your care. You get to be active in your treatment. You get to be active and have a say in how your body is handled and how you heal. So I think acupuncture is a great way to raise that body awareness around your physical, mental, emotional habits, the media you consume, all those things.
Yeah.
That's great. That's it.
And what's the time frame? So are people usually coming once a week or several times a week? And then sometimes I'll get that question, well, how long does it last? How long does the effects last?
It depends.
And I know that
on the
depends,
person.
of course.
So, so I always tell people, let's say you're 85 and you've had chronic knee pain. You've been told that you need to have a knee replacement. Maybe we help with some of the discomfort, but if you truly do need a knee replacement, you're probably going to need to go see your surgeon. If somebody who is in that age demographic, they've had low back pain for, decades, it might take longer. It might not fully resolve. A lot of times as we age, we have arthritis, we have degeneration over time in the spinal cord, things like that. So my hope is that we get to a place where you come see me once a week. You see me every other week. You see me once a month. You only come when you have a flare up. That's the hope. If somebody's young and they have an acute injury, meaning it just happened, they're a soccer player and they rolled their ankle, you come see me right away. Yes. I mean, you're probably going to heal really fast, especially if you're young, active, and healthy. So it depends on your age. It depends on your health as it is. Sometimes if you have an underlying congenital issues or comorbidities, it might take longer to see resolution with whatever you're coming to see me for. But generally, I tell people anywhere from the 6 to 12 visit. Hopefully you start to feel better and see longer standing change. So, more than a couple hours, more than a couple days. And I usually have people come 3 days a week because the more you come in a shorter amount of time, the better results we'll see quicker. And then hopefully you come like once a week or twice a week. We kind of taper you down and see how things go. My experience, though, between the 3rd and 6th visit, people tend to see improvement more often than not. Even after the 1st or 3rd visit, sometimes people go home and they go, I was pretty sore when you did those trigger points on me, but then the next night I just slept amazing. So I think it's when you give your body that time to reset, and you can't really go anywhere because you have needles in you. So you're kind of like stuck on my table.
Forced relaxation.
You're forced to relax. Yes. Or forced to not move. I think that really can be very healing in and of itself.
Yeah.
Definitely. It's the stillness.
It is.
It's a forced stillness. We'll call it that. But I also kind of think that it balances me out. I don't know. I just feel like I'm more balanced afterwards.
I always leave.
So
I'll walk in and go, I always sometimes go, I hope she's not going to find that point that I know that's going to hurt. And then you always do. And then when I leave, I always go, I feel so much better.
Yeah. These are some final questions that we ask everybody. So how do you view failure?
Oh, that's a good question.
I know.
I hate
that's why we ask.
Don't like to fail at anything. No. I would say, how do I view it?
Mm-hmm.
I would say that I've probably failed a lot in my life. But whose standard is that by, right? So, I kind of have used what I guess would be considered a failure or a shortcoming, and I kind of have taken that and just kept going.
Yes.
Just kind of kept going. And sometimes I really don't want to. Sometimes, like, my alarm went off this morning and I was at a concert earlier in this week, and I'm old now, I feel like, so I don't want to get up. But, I was like, but you got to get up. You got to get your run in. If you don't get up at this time, you're not going to make it here in time. So, I just kind of look at my responsibilities and obligations and promises that I've made, and think about, the things that are important to me. And I'm like, okay, you're just going to get out of bed. You can sleep. You can
So
hit
you
your
got out
alarm
of
one
bed.
more time. I did. I got out of bed. I got out of bed 10 minutes later than I usually do, but I did do it.
But that's
Good.
that's a good way to look at it. We
It
have
is.
to keep moving forward.
Mhm.
Yep.
Things are gonna happen in life, and you can't just shut down and stop. You
Yeah.
have to keep going.
Exactly. So what are your 3 most important strengths? I know you have many strengths. What do you think are your,
Don't overthink
to
them.
you,
Oh.
to you, just go like right from your gut. What is it?
Survival, I think, survival and sort of working towards actually living. Because sometimes, sometimes I do really feel like I am in survival mode, especially different losses you experience in life that are just happen, or like grievance, things that you grieve. And I think that I just try to get through that time where I need to just kind of survive and get through this week, and then, or this day, or this minute, or this hour, and then hopefully work towards living and not just survival.
Okay, so that's 1.
That's
Survival.
1, yeah. I'm still alive. I've made it.
You did.
Yes.
This far. I like to problem solve. So sometimes, if a patient comes into my treatment room, for example, and they're like, hey, do you know anything about blah, blah, blah? And I'm like, actually, no, I have no idea what that is, but I'll look it up and I'll get back to you. I love to learn. I'm really curious. So I think that
curiosity is definitely a strength. There's no question.
So I think that that's what makes this so fun for me, because you are never going to know everything. It's
never the same.
No.
And it's never the same. And what teachers tell you, bodies don't read textbooks. Nobody's going to come in and present exactly how it does on a page. So I think being curious is probably another one.
Sounds like you had some really good teachers too.
Some great teachers. Yeah, some really great teachers.
All right, one more.
I like to laugh. I like
humor.
to laugh. I like to sort of find the funny within the darkness. And
so important.
Yes.
Just like have fun with it.
Enjoy your life. Yeah.
And that's contagious too,
Yeah, it is.
because, although you can't really hear in treatment rooms, you can hear laughter, so that's great. So what's going well in your life?
Well, work is great. Work has been good. We're getting, we kind of have ebbs and flows a little in terms of busy. It's always pretty busy, but as the spring kicks in the summer, it gets even busier. My dog is doing great. We had a little bit of a hump there with his surgeries and things. I'm in a great relationship. Yeah,
lots of good blessings.
I'm feeling good about, getting up in the morning. It feels
excellent.
Feels
Except
good.
if you go to a late concert.
Yes.
If I'm not in bed and asleep by 9, I am.
Well, that's Chinese medicine. We just learned that. You have to be flat between 9 and 10.
Yes.
I got it. All right. So then this is also a few questions that we ask everybody. Is there something you'd like to change? It's a yes or no answer.
Not right this very second. No, I'm feeling pretty good.
Okay. We're going to leave it at that.
Yes.
And Jen, we're going to finish up.
That's it.
Because we have 24 seconds.
We have 20 seconds left.
But we're going to go over.
We're going to say this, that we've been waiting to have Danielle come on for a very long time. And we're so glad that you could take the time away from work to come and do this, because we really value you. And our families value you, and all the patients that I recommend, they also value you. So you are really helping a lot of people. Not just us.
You are.
Not just us. And that's why we really wanted to showcase you, because we think that you're doing that great of a job. So thank you for sharing your time with us. And if you are interested in learning more about us, we're going to go over our time right now. But in the show notes, all of our information is listed. We are on social media, on Instagram, on TikTok. The podcast is on Apple and Spotify and YouTube. And we always like to say that this podcast is produced and recorded and edited at Black Swallowtail Studios. They do a great job here. So thank you for tuning in, and we will be back with another episode. And Cindy always has our closing statements.
So remember to pause, breathe, and then respond, and always do hard things. And check out my Instagram, because we have a perfect example of do hard things.
Yes. Thank you.